I'm Dr. Brian Ashman, Orthopaedic Surgeon and Clinical Director of Surgery at Canberra Hospital. I'm here today with my colleagues, Professor Thomas Brussell, Director of Anaesthesia, and Sister Kerry Reeves, Assistant Director of Nursing for Pre-operative Services. Although it happens very rarely in the ACT, wrong site surgeries, wrong patient surgeries and retained surgical objects still occur. To address this, all Australian states and territories have rolled out the World Health Organisation's Surgical Safety Checklist. The Royal Australian College of Surgeons and College of Anaesthetists have endorsed its use for every procedure performed in the operating room.
The Surgical Safety Checklist is the last and final safety check before surgery. It asks the anaesthetic, surgical and nursing team to confirm they have the right patient for the correct and consented surgery and that appropriate monitoring and other equipment is available. The checks can be done quickly. It only takes a couple of minutes to do properly.
The checklist guides the members of the surgical team to ensure they have introduced all members of the team appropriately, and the plan for the surgical procedure is also discussed. It is recommended that this discussion occurs whilst the patient is awake, so they may contribute by confirming or clarifying any details.
This simple communication tool has now been studied around the world and has been shown to significantly reduce surgical complications, morbidity and mortality. One of our orthopaedic teams, led by Professor Paul Smith, will now show how it's done.
Okay everyone, we're ready to go. It's time for the surgical safety checklist. Claire, would you lead the discussion?
Sure. Morning everyone, I know we've been working together all morning, but can we just introduce ourselves for the purpose of this safety training video? I'll start off. I'm Claire, the Orthopaedic Registrar.
Vaughan, the anaesthetist.
Sharon, the anaesthetic nurse.
Melanie, the scrub nurse.
I'm Ludi, the scout nurse.
And I'm Paul, the orthopaedic surgeon.
Hi Julie, can you please confirm for us your full name and date of birth?
Sure, my name's Julianne Roberts, 23rd the 8th, 1982.
Correct. And the UR number is 500-13245.
Correct. Julie, what operation are you expecting this morning?
You're replacing my right knee.
So I have a consent form here for a right total knee replacement for Julie Ann Roberts, born 23/8/82. UR number is 500-13245. It's signed and dated.
And I know we've already marked your leg, but if we could just have another look at that now. So the right leg has a mark there.
Correct.
Do you have any allergies at all, Julie?
Yes, I'm allergic to betadine. I come out in a rash.
Can we make certain that we use a chlorhexidine prep then this morning?
No trouble.
Now I know that we're not expecting a blood transfusion today, but can we make certain we have blood available if we need it?
Yes, there's 2 units of cross-match blood in the OT fridge.
Fantastic. I've ordered some DVT prophylaxis to start tonight. Do we also know that we've got all the implants available?
Yes, implants are here and I checked them this morning.
Fantastic. Well, I'll just go and check that the imaging says Julianne Roberts. Okay, so we have here a right knee and it says Julianne Roberts with a date of birth 23rd of August 1982, and the UR is 50013245, so that's all correct. Have you given the antibiotic prophylaxis?
Kefazole, 2 grams.
Fantastic. All right, any anaesthetic concerns at all?
None at all.
And any nursing concerns at all?
We don't have a north field retractor available, but we have an AdSense if you're happy to use that.
That will be fine. And can we also make certain that we've got a smoke evacuator ready for the diathermy? All right, team, it seems that we're ready to do a routine total knee replacement today. No concerns on our part, so we're good to go.
Great. Julie, a couple of nice slowly, please.
It's time for the checkout part of the surgical safety checklist. Can we just confirm that the surgical count is correct?
Yes, the count is correct.
And the specimen that we've got is labelled right knee, synovial tissue for histopathology?
Correct. And the patient's name is Julie Ann Roberts, born 23/8/82, and the UR number is 500-13245.
That's correct. Any anaesthetic concerns for recovery?
No, the guys will just keep an eye on the dressings, make sure they stay nice and clean. She's got an analgesic plate written up for her, and make sure she's not nauseous before she goes to the ward.
Okay, that's great. It looks like we're done.
The root cause of surgical error and complications is often the failure of communication between the patient and staff. We know how important and effective the surgical safety checklist can be and how it supports a patient safety culture. And that's why we have implemented it in all of our operating rooms at Canberra Hospital. I'd like to remind all of our surgical and anaesthetic colleagues, registrars and nurses that to provide the safest care to our patients and comply with hospital policy during their work here, they need to ensure the surgical safety checklist is performed prior to every procedure in the operating room.
Besides the obvious medical benefits for the surgical safety checklist, it's a fantastic way to establish some rapport in the mornings, everyone introducing themselves. It helps to get to know everyone in theatre and just break down some of the barriers. It results in a great working environment.
Doing the surgical safety checklist has highlighted problems with imaging, such as having the wrong side put on the imaging for the patient.
The thing I like best about the surgical safety checklist is that the patient is having the procedure that they have signed the consent for, and there is no doubt within the team operating that an error can be made.
The surgical safety checklist has helped highlight any missing equipment we may have before the operation and helps fix any delays that may occur.
Initially, when we started doing the surgical safety checklist here at Canberra Hospital, it was quite cumbersome, but the more we do it, the more routine it becomes, and it's now become a seamless part of our practice.
The surgical safety checklist is a really important thing to get right. It's a multi-step process which maximises the chance of selecting the correct operation on the correct patient at the correct time. It's absolutely imperative to make sure that there's a minimal risk of surgical site errors.